Welcome to an update for the 9th edition protocols for the state of Alabama. One of the things they have done is they have taken the policies and operational guidelines out of the protocol manual. We're going to have a new manual to come out with those. We've added 2 new levels to the state of Alabama. One is a community paramedic and the other one is a critical care paramedic, which is going to be your flight paramedics and your critical care medics. The community paramedic can only do BLS care, and if they identify anything else that needs to be done, they call 911. A couple of minor changes to the trauma system and stroke system. Hopefully you know you need to call TCC for stroke patients, and for TCC for trauma patients, the highest level needs to contact TCC. Be prepared for TCC to ask you the following 7 questions when you contact them. For some reason you cannot obtain an airway, or if they are in shock and you don't have an IV, or if they're bleeding profusely, you need to go to the closest facility. I know we're kind of excited to not have to use backboards on all of our patients. We can now use Spinal Precautions, which is just a C-collar. If you suspect they have neurodeficits, or if they have neurodeficits, though, we still use a backboard to immobilize them. I know we're excited about getting ketamine, lots of uses for that. It is a bit of an anesthetic and an analgesic and amnesic, so it is good. We obviously don't want to give it if we know they're allergic to it, if their oxygen status is too low, or if they're pregnant or a small child. If we give it too quickly, it can cause some apnea, so be careful about giving it too quickly. Contraindicated for eye injuries, and it may cause some salivation. If it does, go ahead and give some atropine to reduce the amount of hypersalivation and keep that airway clear. The doses are 0.2 milligrams per kilogram for slow IV push, 0.5 milligrams per kilogram if we're given intramuscularly, or if you have a pediatric patient, you can give 1 milligram per kilogram intranasally. For the excited delirium case, this increases. We give 1 milligram per kilogram slow IV, or 4 milligrams per kilogram intramuscularly. Again, that is for excited delirium cases. Labetalol is a very good medication for hypertensive crisis or severe hypertension. I'm kind of glad we're getting this one on the trucks too. Just be careful if they have asthma, if they're in heart failure, they have some significant heart blocks, or if they're in shock or cardiogenic shock. We don't want to give it then. We're going to give it slow IV, 20 milligrams over 2 minutes, and just watch out for wheezing, vomiting, and hypotension developing. We don't want to use this for children. For allergic reactions, I just want us to note that EpiPens can now be used by all levels of EMS providers. EMTs can use them too. Cardiazem is another medication that we have. This one is going to be used for severe tachycardias. If it's stable but still not responding to other things, we're going to give it slow IV push. Racemic epi, kind of excited about this one. We can use this for children that are having croup or stridor. You mix it up just like you would a regular nebulizer. And now that epi can be given intramuscularly with the EpiPen, we had to update the epinephrine protocol. Another new one that we have is narkitipine. And this one is used for hypertension. Probably not going to use it as much as labetalol. It is a category B, so make sure you contact a medical direction first. Be cautious if you're using it with other calcium channel blockers. Also be careful with stenosis, and we're going to give it 5 milligrams per hour. TXA is another one that everybody's excited about to help control bleeding. This actually prevents the clots from dissolving. We can use it if the injury is less than 3 hours old and we suspect they have some significant bleeding. Also note that we can use this on vaginal bleeding. So if they have a severe menstruation, we can use it then. Don't want to use it if we suspect a stroke or subarachnoid hemorrhage, if they have color vision problems, if they're pregnant, it's been more than 3 hours since they were hurt, or they were under 18 years of age. Of course, we don't want to use this if they are allergic to it, if they have a history of blood clots that they might need, and if we give it too fast, again, we can cause some problems. So it's not going to be given IV push, it's going to be given in an infusion. 1 gram over 10 minutes, followed up with a maintenance strip of 1 gram over about the next 8 hours or until bleeding stops.